Hey everybody, welcome to Strategic Health TV, Episode 2. I'm your host, Dr. John LaBrie, and on today's episode, we're going to be talking about the nutrient that you are most likely struggling without. Now, the reason why I say that you are most likely struggling without this nutrient is because 60% of North Americans are deficient in this nutrient. And what the research is showing is that deficiency of this nutrient has been connected to and has believed to be contributing to an entire array of different health issues that we're going to go over in a little bit. I'm also going to be reviewing with you a little known fact or secret, if you will, regarding this nutrient. And of course, I'm going to be sharing with you some of the best sources to get this nutrient into your diet. So the nutrient that I'm referring to is omega-3 fatty acids, specifically EPA and DHA. Now, when most people think about the nutrients that we require in our diet, most people realize that there's a recommended daily amount that we should have, like B vitamins. However, with omega-3s, it's slightly more complicated than that. While there is a general recommended amount on a daily or weekly basis that I'm going to go over with you, what most people don't realize is that the biggest health benefits of this nutrient come in its ratio relative to another nutrient called omega-6s. Now, ideally, we should have an omega-6 to omega-3 ratio in the ballpark of 1 to 1 or 2 to 1, meaning for every 1 or 2 units of omega-6, we should have at least 1 unit of omega-3. However, with today's modern diet, what we're realizing is that most people are actually closer to a 15 to 1 or even 22 to 1 ratio of omega-6 to omega-3, meaning we're getting 15 to 22 units of omega-6s for every unit of omega-3 in our diet. This gross imbalance is believed to be a huge contributing factor to a whole lot of different health issues that we are seeing, including learning disorders, hyperactivity and behavioral disorders in children, to memory problems, depression, lowered immunity, fatigue, soft or brittle nails, cracks in the heels of your skin and your heels, or even your fingertips, or even atherosclerosis, heart disease, and cancer. Okay, so as you can imagine, the strategy here is going to be twofold. It's not only to increase our omega-3 intake, but also to decrease our omega-6 intake. So where do we get omega-3s from? Omega-3 fatty acids like EPA and DHA are commonly found in small cold water oily fish like wild-caught Alaskan salmon, anchovies, sardines, and mackerel. You can also find farmed tuna in some US and Canadian local farms, as well as barramundi, tilapia, crayfish, and catfish from domestic farms as well that are believed to have still an adequate nutrient profile with minimal toxic load involved. Now, if you love fish and including in your weekly diet, 2 to 3 servings per week is generally recommended in order to get the right amounts of EPA and DHA that you need. And one of the best things about getting EPA and DHA from the source is all of the other great benefits and nutrients that come along with it, including vitamin D, selenium, protein, cofactors, and other fatty acid profiles that can add a whole lot to our health. Now, in terms of omega-6s, they're typically found in cereals, grains, flour. We're looking at pastas, vegetable oils, soy, corn. And while omega-6s can be a whole other episode in and of themselves, suffice it to say that we are consuming way too many omega-6s, especially in ratio and relationship to the amount of omega-3s that we're taking in. So any steps that you can take to minimize or reduce the amount of breads, cereals, and grains that you're consuming in your diet will go a long way to helping you attain the ideal ratio of 1 to 1 or 2 to 1 omega-6 to omega-3. Okay. Now, I know some of you guys are saying, well, what if I don't like fish? Or what about all of the other pollutants or toxins that a lot of fish nowadays are believed to have, especially farm fish? I get it. It's a valid concern, and looking at the research, there's still concerns within the research on that very topic. However, I have noticed some other research indicating that in the case of mercury, as long as the fish that you're eating has a high enough selenium content, it will actually bind to any mercury that's in the fish and prevent it from creating any harm to your body, so giving you a net positive effect. But outside of this, there's obviously fish oil supplements that you can take. Okay, as long as you don't have any shellfish allergies or you're not taking any blood thinning medications, fish oil supplements can be a viable option. Depending on the fish oil that you're taking, the general recommended amount is 20 milligrams per kilogram of your body weight per day of total EPA and DHA to get you to that ideal ratio. Now, what I need to warn you about is that not all fish oil supplements are created equal. 90%, it is estimated as upwards of 90% of fish oil supplements on the market have some level of mercury or other pesticide residue content within them. A lot of them are believed to have oxidized product or even just made from lower quality ingredients, and as a result can create a net harmful impact versus having a more beneficial impact for your health. So obviously, as much as you can, avoid fish oil supplements that contain these hazardous contaminants by making sure that you're purchasing your fish oil supplements from a reputable, trustworthy company who ideally does third-party testing to make sure that their product does not contain these chemicals and hazards. Okay. Now, in our office, we use Carlson's Very Finest Fish Oil Supplement, and the reason being is they have a long-standing history of not only being a top-notch, top-quality product. They are 5-star rated by the International Fish Oil Supplement Program, and outside of having the top level of potency and purity, really they just taste good as well. And that's something that we need to consider ultimately when we want to have it on a regular basis. So if you're taking a fish oil supplement and you're not sure if it's the best quality product, maybe I can help. Take a picture of your bottle and send it to me via Facebook Messenger, or better yet, bring it into the office and let me have a look. That way we can make sure that you're not only taking a good quality product, but you are also getting adequate amounts so that you can express the greatest level of health possible. Hopefully you found this helpful and beneficial. If you have any questions, please feel free to comment in the comment section below, or send me a private message via Facebook Messenger. I'd be more than happy to help. If you did find it beneficial, please feel free to like it and share it, because maybe your friends will find it beneficial as well. Have a fantastic day, and I look forward to seeing you again soon.